Twitter isn't for everyone, and there may be better social media platforms for some people. Some people are better at writing blog posts like Don Deason and writing Ask a Connection, or Brian Vardabedian's a pediatric gastroenterologist, and he writes short blogs almost daily, and they're amazing. But a lot of people really gravitate towards Twitter because it's kind of like writing poetry, like a haiku or something. You're limited by the character count, but you have to get very concise commentary. And part of that also is that you can still share things with tiny URLs. So you can share a new post from New England Journal of Medicine, you can share a press release about a new drug approval, or you can share a blog post or your institutional information. So there are a variety of ways you can use it, and it's a form of media, so many physicians are on various media platforms to promote their institution, to try to engage with people, to try to educate their colleagues, and I think it's increasingly become important to help educate patients. So patients have easier access to social media than to journals. They have easier access compared to meetings, which require registration fees and travel. So it's a nice way to communicate to a broad base of people. And what we're seeing, at least in ASCO and ASH, and I think recently in EBMT, is that we're seeing more than just physician-to-physician communication, but we're seeing diversification of communication to industry, media, patients, and I think that's all good for getting people connected and out of silos, which I think we talked about at our session today a little bit. So people don't have to get on it, but if they're interested, there's a variety of tips for how to get on from Matthew Katz on Twitter 101, 102, 103, and I've published a couple things with colleagues. So a good reason to get on it is to try to engage with people and connect. However, if you don't want to engage and connect and want to be more passive, you can just basically get information in a fast fashion. So for instance, you could just follow BMT journals, you could follow ASH Hematology, you could follow ASCO, you could follow New England Journal of Medicine. You're going to get a lot of information. If you're interested in how the public sees things, you could follow Wall Street Journal, New York Times, LA Times, etc., or your individual country, and whatever their journal platforms are. And you can see how reporters and other people are responding to journal articles. So it depends what you want to do. If you're interested in health economics, what you're following is different than if you're a clinician or you're a basic scientist. So I like it because it has diverse ways of interacting with social media like Twitter, and you can individualize it to your own taste. And like we talked about today, some people have very strict rules about what they do and don't do, and some people are using it more broadly and not worried as much about what people think. So I think it's great that we have this diversity of opinions and how people approach it.